obviously, from my perspective, I think one of the ways to do that, one of the ways to solve that issue is to get people accredited and board certified, because just like any other profession, when you accredit and board certify professionals, really what you're doing is saying this individual is kind of, blessed externally to say that they're meeting a minimum benchmark, a minimum standard, a minimum competency, so that if the company is audited in the future for what they're doing with their medical affairs, they can turn around and say, look, we've actually got an organization, that's actually vetted us to make sure that we meet minimum standards of competency. And I don't know if you know this, but in March of 2021, we actually we did a briefing. I was part of a briefing for the United States Congress, and I spoke before Congress about this issue, about standards in the pharmaceutical industry. At the time, it was Congressman of Kentucky, Brett Guthrie. And I think the point is here that from a government perspective on Capitol Hill, they know the work that we do. They're aware of what medical affairs does. They're aware of medical science liaisons and how they're different from reps. And I think in the end of the day, the question is, how do we protect the integrity of what we do? And I think that's one of the ways to do it.